Assalamu alaikum. Welcome everyone, and thank you for the organizers of this conference. With special thanks to Dr. Najwa. My name is Marwa Faraj Farjani from the Faculty of Medicine at the University of Benghazi. It's my pleasure to lead you through today's session. Together, we will discuss the important role nurses can play in enhancing parental education. Let's begin. Many studies worldwide indicated that poisoning is a global health concern and a leading cause of unintentional injury among pediatric populations. One study was conducted in Benghazi Children's Hospital found that the accidental poisoning are most prevalent in children under 6 years and most cases are unintentional. Evidence suggests that unsafe storage of medication is a primary risk factor for pediatric poisoning. Our subject focuses on the first component of the chain of survival behaviors, emphasizing the importance of proactive prevention and preparedness, and underscores the critical necessity of maintaining ongoing situational awareness regarding potential risks and hazards in order to mitigate the occurrence of emergencies. Nurses also can advocate and promote the domains of early recognition, first aid, health, and recovery later. But here we are focusing on prevention. We used a cross-sectional survey to assess knowledge, attitudes, and practices of parents regarding the prevention of accidental drug ingestion in children. We conducted this study exclusively in the outpatient department of Benghazi Children's Hospital in January 2025. The overall attitudes towards safe medication storage and disposal among both parental groups were predominantly positive. However, mothers demonstrated better practices regarding safe medication storage and disposal compared to fathers. This finding had shown a clear gap between knowledge and practices. When participants were asked about the primary reason for having medication stored at home, the most common cause was as needed basis. Furthermore, when they were asked about the most frequent methods they use to dispose of medications, the most common answer was throwing it in the trash. Another important aspect to consider is the participants' answer regarding the most common source of information, which was the medical staff. This highlights a key area where nurses can play an educational role. But what makes nurses the key professionals for this task? Nurses in particular have frequent contact with patients and parents, and they are highly trusted because they spend much more time with them. And they also have key opportunities for teaching during routine immunization visits, well child visits, and outpatient clinics. Nurses leading change through community-based education programs such as maternal and child health clinics, pediatric outpatient departments, routine immunization visits, kindergartens, and schools. School nurses in particular play a vital role as educators for parents regarding the safe storage and disposal of medications. Their responsibilities include informing parents about best practices to prevent medication errors, accidental ingestion, and misuse. In addition to direct education, nurses collaborate with pharmacists, environmental health officials, and policymakers to promote the establishment of medication take-back program and public awareness initiatives. Active participation from government agencies, including the Ministry of Health and Ministry of Education, is essential to ensure the program is consistent across all communities, supported by policy and sustainable in the long term. Their involvement also allows proper monitoring and evaluation of progress and impact. Our recommendations include integration of the medication safety education into every parent encounter, targeting the key moments like immunization visits with child visits for teaching, develop simple visual educational materials in Arabic, champion medication take-back program at hospitals and clinics, collaborating with prescribers to minimize excessive prescriptions, advocating for policy change supporting safe disposal infrastructure. In conclusion, bridging the gap between knowledge and action through targeted educational and awareness initiatives is crucial for motivating behavior change and preventing pediatric harm. Let's highlight the key takeaways. Pediatric medication poisoning is preventable. Mothers demonstrated better practices than fathers, but we have to target both parents and education. Nurses are essential leaders in proactive prevention and preparedness. By embedding medication safety education into routine care, nurses support sustainable health care and protected children. And always remember, every conversation is an opportunity. Every family educated is a child protected. Thank you.